hope you're having a great day. Today I want to talk about the importance of Kegel exercises. You would have heard this word Kegel exercises for the longest time. I've covered a couple of videos on this before, but today all the more reason to stress on the importance of doing this. Men, women. For the longest time, people only thought that women have to do Kegel exercises, but men have to do it as well. And today we're going to understand why. Now, when you learn to do these exercises, it doesn't take you more than 2 to 3 minutes in a day. It's simple, it's easy, and it's necessary. The amount of cases that we see today, it used to be in the age group of 70s and now 60s, and now we're seeing people in their 50s, 40s, and even in their 30s having a weak pelvic muscle flow. Your pelvic muscle, what are Kegel exercises? They're exercises to strengthen your pelvic floor muscles. These are muscles. How does a muscle get stronger when we work it out? The heart is a muscle. It needs to be worked out. Your biceps, your triceps, your quads, your glutes, these are all muscles. So we know to make a muscle stronger, it needs to go against a certain amount of resistance, which can become progressive over time. So what happens? If we have weak pelvic floor muscles, a lot can go wrong, especially as we age. Because as we age, we know that our muscles get weaker and weaker. Today, urine incontinence is a big problem amongst men and women. What is urine incontinence? It's losing control of your bladder. So you tend to pass and leak urine even when you're standing, when you're walking, when you're sitting, and sometimes it becomes unconscious. You don't even know what's happening. Now, certain people go through surgeries. Some men go through prostate surgery. Some women go through surgeries involving the pelvic region, and those muscles get weaker and weaker, and all of a sudden you have urine incontinence. Sometimes you have problems like pelvic organ prolapse. Now, this can happen when there's too much of stress on the pelvic floor muscles. This can happen sometimes through childbirth. It can happen when you're overweight or you have a lot of lower abdominal fat, like a lot of it. And that puts a lot of stress on your pelvic floor muscles, weakening them over time. Because your pelvic floor muscles will support that weight, that excess weight which you shouldn't have, and your bladder and everything around it, making it weaker and weaker. So in a prolapse, what's going to happen is, in a woman, you can find your bladder or your uterus actually start to sag towards your vagina, creating a lot of complications, including urine incontinence and sometimes even poop incontinence, where you will pass fecal matter without even knowing it. Okay, so the point is, can this be prevented? Absolutely yes, by strengthening the muscles. So, number 1 is urine leaking. Number 2 is the improvement in the quality of orgasms. I never believed this until I started reading the science of it. Pleasure in a man and a woman. A lot of men suffer from premature ejaculation. You can actually make this better. There are many reasons for premature ejaculation, but one of the solutions is by strengthening your pelvic floor muscles. So for men, when they do Kegel exercises, they can actually reduce premature ejaculation, and they can actually improve the quality of their orgasm. It's the same thing with women. You can improve the quality of your orgasm by strengthening your pelvic floor muscles. So that's an added benefit that comes with it. Now, what happens is, our pelvic floor muscles can also get weak when we exercise the wrong way. If we're not fit, but we're trying to overtrain. You see a lot of people, they overtrain on bodies that are not strong. And that's why an exercise program has to be holistic in nature. You should be working on strength, cardiovascular, mobility, flexibility with sufficient rest. A lot of people, they get motivated to work out, but they don't understand, first you strengthen the body. You know, a lot of women after childbirth jump straight into intensive workouts. And a lot of these women today actually have pelvic organ prolapse. Because you need to understand, you just delivered a child. You can get back to your workouts, but you need to let the pelvic floor muscles get stronger first. So there's a time and place for everything. You're recovering from a surgery, for example. Yes, you want to get back to your workouts, commendable, but you got to do it patiently, slowly. Too many people jumping back into intensive workouts, and when their pelvic floor muscles are not yet strengthened, and then they have all of these problems. So the point is, work out, but work out the right way. Don't overtrain, don't do exercises with the wrong form that can actually cause you to have a weak pelvic floor muscle, which causes all of these problems for you. So keeping the pelvic floor muscles stronger means You will have a stronger uterus, you will have a stronger bladder, and even stronger bowels. Your bowel system and your bowel movement will be way, way stronger. So now how do you do Kegel exercises? There are two ways of doing it. There are many ways of doing it. Number one, if you practice yoga, yoga is one of the best ways to strengthen your pelvic muscle, pelvic floor muscles. There are certain asanas that you can do, and we'll probably cover that in a separate video where we'll do a demonstration of the top 5 to 6 asanas that you can easily do at home if you have no injury to strengthen your pelvic floor muscles. And that's why yoga is a way of living. It's not just exercise. It contributes to almost every ailment that you can ever have, strengthening every muscle, every joint in the human body. But I'm going to teach you a simple way to do a Kegel exercise right now. This is the way the world has taught us. This is the way our doctors teach our patients as well. It's very simple. All you need to do, you can sit, you can sleep, you can stand. What I want all of you to do right now is pretend you're peeing, okay? And if you're peeing right now and I tell you to stop peeing, okay? Stop peeing while you're peeing. What are you going to do? You're going to contract certain muscles that stop you from peeing. Try that right now, okay? Close your eyes. Imagine you're peeing and I tell you stop peeing. Which muscles do you engage? Which muscles do you contract to stop peeing? Okay, that's exactly what the Kegel exercise is. So now I could be sitting, okay, and I know how to contract that muscle using the visualization of what I told you. Imagine you're peeing, and which muscle do you contract? So there's a simple way to do it. It's called a biofeedback way where, you can actually, a woman can do it by simply inserting her finger in the vagina and then contracting. And if it tightens over the finger, you're doing it the right way. A man can do it by stopping to pee midway, or you can even gently insert the tip of your finger, lubricate it in your anus. And as you contract, it should tighten around your finger. Technically, you don't even have to do that. You don't have to go to step 2. Step 1 is simple. Imagine you're peeing and stop peeing. Okay, stop peeing. That's the same muscle. Now the exercise is simple. Contract those muscles and hold it for 10 seconds. Okay, if you can't do it for 10 seconds, do it for 5 seconds. And do 5 counts of this. 5 count. Count number 1, hold for 5 seconds, release, relax. Count number 2, hold for 5 seconds or 7 seconds, release and relax. And do 5 to 6 counts. This should take you less than a minute or 2. You can do it once in the morning. You can do it once in the evening. Okay, and now you can do this when you're stuck in traffic in your car, not while you're driving. Maybe if you're being driven, you're in the train, you're on a flight, you're sitting in your office chair, you're in the middle of a boring meeting. Do your Kegel exercises. Do not overdo it. You do not have to overdo it. I have people who are saying, oh, Luke, I'm holding for a minute and a half. I said, there's no prize for doing that. You don't need to do that. Okay, 5 to 10. I would like you to reach 20 seconds max. That's all. 6 counts of 20 seconds. Okay, don't push yourself. Start off gradually. Okay, if you have a hernia, if you're recovering from a hernia surgery or you have a hernia, don't do Kegel exercises until you recover. Or you can do it very gently for 3 to 4 seconds. But it is so important, especially patients who have gone through prostate cancer or prostate surgery, or even men who have an enlarged prostate. This is great for you to reduce the inflammation in your prostate. This is great for you. It's great for you men sexually as well, women as well. And men, it is also great for you if you have urine incontinence. So if you are wearing adult diapers because of a certain surgery you've gone through, by practicing these exercises, it's great for you. It's great for everyone because as we age, all of our muscles get weak. And we don't want to accept or have to accept that urine incontinence comes with aging because everyone doesn't have it. The point is, strengthening these muscles will make it better for you. Now, what's the third natural way of strengthening or doing a Kegel exercise? When you have intercourse, when you have sex, when you make love, when a man ejaculates, when a woman comes, automatically these muscles contract. So that is why having a healthy, safe, respectful sex life is also great as a Kegel exercise for your pelvic floor muscles. But I do want to encourage each and every one of you to do this on a daily basis because you see, most of us are sitting. When we sit, we do not engage the pelvic floor muscles, which means we're making them weaker with more sitting. That's why it's so important for us to be active, not sit in one place for too long, and do your Kegel exercises. Now, let's say you're aging gracefully. You're in your 50s, 60s, 70s. You're a senior citizen. It is never too late to start. It is never too late to start. I have an 86-year-old lady who has started doing Kegel exercises over the last 3 months. Her urine incontinence problem has disappeared. And she owes it to the exercise because that's the only new thing that she's been doing. So you see, the body is resilient. It is never too late to start. You can be in your 20s, 30s, 70s, 80s, 90s. All you need to do is do it with consistency, listen to your body, know when to stop, know not to push it. More Kegel exercises doesn't mean better sex. More Kegel exercises doesn't mean a solution to your problem. You do it in your capacity. What is more important than intensity is consistency. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep, and remember, you care is all about you.